healthcare entities, whether it be hospitals, health systems, or health plans, and other payers to provide population management programs using PERS and remote patient monitoring. And then One Call Alert is a competing brand that operated independently for several years, but since 2019 has been inside our company portfolio. The company has been in business for nearly 14 years, founded in 2006. Today, we operate in all 50 states. We're serving over 300,000 active subscribers. And in any given month, we dispatch help to someone in the event of an emergency over 8,000 times. That's every 5.5 minutes approximately. We're providing help and emergency assistance to somebody using our products in the time of an emergency. The company is based in Boca Raton, Florida. We have over 250 employees today. We are financially healthy, and we've been recognized by both Deloitte and Inc. 500 multiple times. But probably the awards that I am most proud of are the Frost & Sullivan Leadership Awards. We've been recognized twice in 2014 for value leadership in the space of personal emergency response systems, recognized in comparison for price versus performance against other products in our category, and then again in 2019 for product leadership and innovation. And I think this timeline helps really exemplify that innovation. We've led the industry in a number of firsts, beginning with the mobility, which is how the company began. We offered the first mobile solution, innovated the classic medical alarm by providing GPS and cellular connectivity to that device so that we can help elderly adults outside of the home. And at that time, 45% of falls happened outside of the home, and now it's become a standard of care. So proud of that. As you can see, the FDA registered device manufacturer in 2012. The company self-registered with the FDA, which means that we are held to a higher level of standards and higher, more stringent protocols and guidelines from a quality perspective that not all of our competitors are held to. Any defect or issues with the product can be publicly posted to the FDA website, so you can always see that history. No reports are ever expunged, and you can see the complete history. We're also subject to a periodic audit by the FDA where they can come in, and if you're not adhering to the processes, you can actually be shut down. But we've been through one audit and passed with flying colors. So I'm very proud of our testament to quality and what it means in terms of the products and solutions that we can offer to our partners. I won't go through this entire timeline, but I will highlight just a couple things. In 2014 and 2015, you can see a lot of innovation around telehealth, activity tracking, medication reminders, telehealth capabilities. This led the way and paved the way to remote patient monitoring, which we began offering in 2015, and initially with the classic base station that you see here, highlighted in the 2013, but now in 2018 we are offering that primarily with our flagship product known as Mobile Vitals Touch, and we'll touch on that a little bit later today. And we've been using the ClearArch Health brand. Again, that's the team that is hosting today's webinar since 2019. I want to take a moment just to talk about our central station monitoring as well, and this is the final slide. We have two completely redundant facilities. So I'm talking about the equipment, the technology, the facility, and the people involved in managing the medical alarm. So responding to the emergency signals in real time, which we do, as I mentioned, over 8,000 times a month. Each of these facilities have multiple redundant power connections, data connections, and phone connections. These utilities are buried and enter the buildings on different sides of the building. So even if the city were to accidentally sever one connection, the facility is still operational. Each facility also has multiple generator backups so that they can operate without power from the grid for up to 30 days. And each facility is completely interchangeable and redundant with the other facility. We have a facility in Syracuse, New York, and then another facility in Corona, California. So in the event of a severe catastrophe that took Syracuse off the map, for example, our Corona, California facility would continue to operate and service emergency signals in real time. That redundancy and failover is in real time. The people involved in the monitoring are subject to an intensive 6-week training program, and that training program is certified by the SIA, which is the industry's most rigorous governing body. And actually, the photo that you see here on the screen is a picture inside on the floor of our Syracuse, New York facility. Heather Seller will talk next about benefits.
Great, thank you, Chris. Good afternoon. Thank you so much for joining us. Although most attendees are from the Medicare Advantage health plans, the information provided to you today can be applied to PACE programs, Medicaid, managed Medicaid, and other community programs. Today, we want to highlight personal emergency response. And why should we include it in your MA special needs plans, but also in your MA plans as an essential supplemental benefit? Personal emergency response is a communication device that the member wears that provides 24/7 access to assistance. Most of us are aware of the traditional use of PERS. If an individual has an emergent event occur, or even a perceived emergent event, they can press their button and the operator at the monitoring center will assess the situation and provide assistance as needed. Well, within the last 10 years or so, we have seen not only the technology of PERS change, but also the utilization evolve. PERS really is the lowest cost, highest impact service for members that you can implement. Most of us have heard of the golden hour, or at least the importance of getting help as quickly as possible leads to better outcomes. No brainer, right? So individuals are 6 times more likely to survive a fall. ER visits and hospital admissions are greatly reduced, and the cost savings on treatment. If individuals get help within the first hour, they are more likely to return home. But as time passes, they are missing meals and medication, which can exacerbate the member's condition and increase the amount of care needed to recover, as well as that cost of care. PERS really empowers our members to live independently longer. And by looking at the data captured, PERS can help us identify gaps in care. Here are some staggering fall statistics, which many of you have seen before. 2.8 million visits to the ER annually are related to falls. 1 in 4 older adults will fall this year. The cost of those falls is about $50 billion. And unfortunately, Medicare and Medicaid shoulder 75% of these costs. This graph represents verified emergency alarms from our monitoring center and the reason people are pressing their help button. And keep in mind, this only represents about 10% of all button presses. So of the emergent alarms, 50% we can see in that green section there are related to falls or general falls. We have another slice down towards the bottom, fall out of bed, which is about 5%, and then another 15% falls with injury. So we have about 70% of the emergent alarms are related to falls. Many other reasons include shortness of breath, dizziness, general feeling of unwell, blood pressure concerns, diabetes concerns, heart-related issues. All of these are opportunities to intervene and impact the quality of care provided to your members and reduce the cost of care by addressing concerns quickly. What we don't see here are the 90% of the button presses that are non-emergent, including live tests, press due to loneliness and anxiety or other concerns. PERS can be the eyes and ears in the member's home, not really in an intrusive way, but when the member needs us most. We can use this data to help identify the gaps in care and address challenges with social determinants of health. So identifying the gaps in care, as I mentioned. It's a pretty large percentage there that social determinants of health influence 50% of health outcomes, leaving clinical care at only 20%. Some of the most common challenges, as you can see listed here, are with meals, transportation, access to healthcare, social isolation. Social isolation, which is now more important than ever, was already an epidemic prior to our current events with this COVID-19. The statistics of unmet needs really speak for themselves there. And currently, we're relying on surveys to identify populations' unmet needs. PERS systems can help identify individual needs in the moment, and the summarized data can provide a broader understanding of the member population needs. It can be broken down by disease states, etc. We're talking about the cost of unmet social needs. You can see here, as we had the same survey findings on the previous slide, what that translates into real dollars. Food insecurity, 2.4 times more likely to go to the ER. Transportation needs causes an individual 2.6 times more likely to go to the emergency room. And then community safety needs, 3.2% more like, or 3.2 times more likely to go to the emergency room. Addressing all of these needs can improve health and reduce costs. So how do we do that? Well, we are already doing that and providing solutions on some level, collaborating with community partners to provide service to address gaps in care, including providing food programs, housing programs, transportation is included in some of the MA programs that we see now. In addition, education. So collaboration is really the key to driving the change. When we talk about who can benefit, the most obvious choice here, or the most obvious group of members, would be those battling chronic disease. 92% of older adults have at least one chronic condition. 77% have two. That comes with not only managing this disease, but dietary changes and medication, all of which need to be monitored and have an impact on the member's health. It's extremely important for Medicare Advantage plans to provide additional support in their MA chronic care special needs plans. We see this. So we see that you're adding additional services, covering meals, covering non-medical transportation, pest control. We understand that all of these things can be impactful when working with the chronic disease population. These are the most at-risk population as well as your highest cost. And although we see trends of the flexible supplemental benefits added to the plans, we find it really important to highlight here that personal emergency response should be considered an essential benefit and not part of the flexible benefits. Providing the right care at the right time, by reducing the overall cost of care and helping identify where there may be gaps in care. So 3 steps to bridge the gap in healthcare Medicare Advantage plans can take. Create a well-rounded, value-based care model, including coverage for in-home care, meals, transportation, and of course, personal emergency response services. Taking that a step further, utilize your connected health, such as personal emergency response and other monitoring services to assist members in their home, delivering the right time at the right care at the right time. And then number 3, capture that data on large connected health population and analyze member needs to further fine-tune the innovative programs that you're currently implementing and adjust levels of care. Now, Chris introduced you to our company history. We'd like to give you an overview of ClearArch Health's suite of products and services. We start with our PERS Classic in-home device. The Classic in-home device uses cellular connectivity. There's no landline required, and each member is provided with a wrist or neck cord that works anywhere in the home. It opens two-way voice communication to our monitoring center, and the member is to wear it 24/7. The wrist or neck cord pendant is water resistant and to be worn 24/7, bath or shower. The next device is we call our Solo. It is a mobile PERS device. This can be used in the home or out in the community. It uses GPS location services as well as cellular connectivity to our monitoring center. That also comes with a pendant that the member wears, either wrist or neck, and they carry the mobile speaker device with them as well. When they're out and about, and when they're home, they can place it in the charging station to act as a base station. Some additional solutions we have include the fall button. The fall button uses an algorithm to detect falls and will automatically activate the PERS device if the member falls and is unable to move or speak. And this is a great solution for somebody that may have a seizure disorder or that may have a history of fainting or dizzy spells. This does only come in a neck cord option due to the way that the device operates. This is a great way to upgrade their service with a fall detection device. And then for your members, we feel it's really important to provide access to the home for emergency responders. Immediate access is absolutely critical to providing emergent care. And with each order for service, we provide a complimentary lockbox to your members upon request. That covers our basic PERS devices, both in-home and mobile. And wanted to talk a little bit about how we're evolving the PERS service. As I mentioned earlier, the evolution of PERS. In order to further address member needs and complement our shared goal of helping seniors and those battling chronic disease age in place, we've developed a program called PERS Advantage. The idea is to provide or to allow members to press their button for anything, and operators will assist the member, whether it's providing social reassurance or scheduling transportation, doctor's appointments, or connecting members to a nurse hotline. Whatever they may need, the access to help is at the press of a button. With this program, we can further dive into the needs of the member population and support existing disease management programs and provide enhanced reporting. PERS Advantage, addressing the barriers to care and ultimately delivering the right care at the right time. Chris will provide an overview on our Touch PERS platform that will be really a game changer for your programs. Chris?
Thank you, Heather. I appreciate that. I'm happy to. As Heather mentioned, this is a game changer in the industry, and as I've shown earlier, we've led the industry again with a number of firsts, and this is true for the touchscreen, which is the first PERS device with an interactive touchscreen. And because we are an FDA registered device manufacturer, we are held to the same quality guidelines as we are with our existing equipment. And so this is a life safety product that has to be extremely reliable. It's tested to a very stringent protocol and reliability, and that's the same here. It's compatible with any of our medical alarms, whether it's our fall button or the classic lanyards, wrist buttons, wall buttons, et cetera. All of those can activate the Clear Touch platform and send for emergency help. But it's also a very engaging platform, and it enables us to do much more than just PERS through this platform. And I think that's especially relevant to this audience, such as the case with this feature, member surveys. So we can send out daily or 3 times a week or various frequency social determinants of health surveys designed to identify potential barriers to care. In this case, for example, in the past 7 days, have you had difficulty filling your prescriptions for any reason? Similarly, we can ask questions about meal delivery or transportation or the ability to make a physician appointment. These are highly customizable, and typically with each program, we will design these questions at the start of a program. They can be modified if we need to throughout the program, And each question, we can design a protocol attached to it, whether it's simple reporting or more involved triage, where our team will mitigate those responses. So for an example of this question here, if the answer is yes, then our care team could call those members and arrange for a prescription delivery, for example. So there's a lot that we can do with this health survey, these social determinants of health surveys. The next feature is telehealth capability. The tablet has a forward-facing camera and is fully capable of telehealth visits. Probably for this audience, if your health plans have already contracted with a telehealth service, such as American Well or MD Live or Teladoc or one of the other services, we can expose that feature through the tablet, creating an additional access node for members to access those services through the tablet. And that's important because it can help screen urgent care visits or potentially allow members to have a telehealth visit before they go to an expensive emergency room visit. We've also seen applications so that this can be used to help reconcile medications in the home or follow-up visits, especially with wound care and many other applications. While I'm talking about a contracted telehealth service, the tablet is also capable, and we also have the framework for health plans and providers that want to provide the human resources behind that, provide the clinicians on the other end of the video visit. Because the same tablet also is deployed for remote patient monitoring, that's very common when we contract with providers directly. And in that case, patients can talk to their own primary care physician in addition to access to a potential telehealth service through the tablet. So just know that capability is there, and we can deploy it in either fashion. As Heather mentioned, education is a very important part of improving outcomes, and that is the reason that we include this feature in the tablet. So you can see the education tile. Clicking this tile will expose the user, will expose a list of articles, relevant articles and videos to the user so that they can watch those. And the way our patient enrollment works is that we identify specific conditions and specific diagnoses at the time of enrollment. So this educational content is customizable, and it's very specific and relevant to their specific needs. So for example, if a member has been noted as CHF patient in enrollment, then we'll provide articles and videos that are very relevant to heart failure patients, providing nutrition tips and how to recognize the warning signs, when to get help and attention. And we can also customize this video content for a number of other purposes. So we can offer a short 2-minute welcome video when you enroll in the program, and we can also provide education on, for example, what to expect in your first telehealth visit. The bottom screen shows an example of one of our educational videos and what it looks like on the tablet while it's playing. This next feature is admittedly not a clinical feature at all, but it I think is a very engaging feature that provides some additional value to that member in their home. That's the photo gallery feature. It's easy for family and friends to add pictures to this so that when it's not in use, when it's sitting on the kitchen counter, or when it's on the coffee table in the living room, it provides a little extra function beyond just a PERS device or just be a clinical education device. You can share pictures through this tablet, and it acts as a digital picture frame. Now recall that a lot of our business is direct to consumer, so this is obviously a very important feature when we are when a member is paying for that service out of their own pocket. We want to make sure it's engaging and useful, but I think it's also helpful and very relevant for health plans because it can help increase the patient engagement and compliance for a program and make sure that they actually want to have that equipment in their home. The last feature that I'll highlight is our remote patient monitoring feature. This is when we offer connected health kits into patients or members in their home. We cover the big 4 chronic conditions: CHF, COPD, hypertension, diabetes, and a few others. And we do that by offering these Bluetooth connected devices. Not all these are provided in every kit, but we do have kits designed for each of those diagnoses I just mentioned. We ship the kit straight to the member's home. We have tech support and customer support teams standing by to help them set it up and get started. And then we have tools for clinicians and contact center that can monitor those members, make sure that they're adhering to their desired protocols, using the devices, and within healthy ranges. And next, Heather will be talking about logistic services.
So ClearArch Health takes care of all the logistics. The device ships directly to the member's home. It arrives plug and play, and so no outside contact is required from an installer. It helps keep the traffic down that is coming through the member's home. Typically, we have 2-day shipping. We also provide US-based customer care to assist with setup and tech support. As I've mentioned a few times, one of the things that we want to capture is the data and the reporting capabilities that allow us to tell the story of what is happening, not only in the member's home, but also across a member population. There are some standard reports that come with any of our services. It can include new enrollments and disenrollments, equipment pending return, which is something we use more internally, but it may be something you want to keep an eye on as well. Active member report, and then also an alarm activity report, which can be either detailed or summarized. Those alarm activity reports have the outcome tracking, which include dispatch and reasons for pressing the button as well. So whether EMS was dispatched and how the member received care. For RPM, there's reporting as well, which is the remote patient monitoring, the alerts by condition, triage rates, and compliance rates. In addition, you can get incident reporting, which is any type of emergency alarm reporting within 24 hours. So just to summarize the reason we're here today, and thank you again for attending. We're talking about developing your Medicare Advantage plan and your supplemental benefit plan for 2021. And it's really important to create a well-rounded value-based care model, as we mentioned, and build out your network, having providers with all types of care, whether it's in-home care, meals, programs, transportation, as well as personal emergency response being what we're highlighting today. And then utilize the technology and embrace the technology to assist you in other plans of care, and then capture the data on your large connected health population and analyze your member needs to further fine-tune your innovative programs and adjust your levels of care as needed. What we really want to talk to you about today is, ClearArch Health, our solutions. We've been in the industry for 14 years. We have the latest in technology. We're able to provide personal emergency response. We've streamlined the process. It's very easy plug and play devices. So we have standard personal emergency response service. Coming in 2021, we'll be expanding with our PERS Advantage service, which helps address social determinants of health a little bit more. And then we also have our remote patient monitoring, and then several things that can be delivered through our touch tablet is our member surveys, education, virtual visits, logistic services, and data reporting. I think that leads us to our Q&A. So that about wraps up our content for this webinar. We'd love to answer any questions that you may have. And I believe, Chris, you are going to be reading those.
Yes, I'm happy to. Nice job, Heather. We have a few questions. I know we're maybe a couple minutes over the half hour, but let's try to answer a couple questions. The first question is cellular service an extra charge? I think I can answer that question. All of the kits that we provide and all the devices, whether it be the PERS or the tablet or the remote patient monitoring, all of those are cellular enabled devices. They work off the AT&T network. and that is inclusive in the price model. So when we offer our equipment, it's inclusive of the cellular charge. None of the patients or none of the members in their home have to have a cell phone even. It's all part of that charge. And the pricing for the programs, it varies, from very basic PERS to, if we're doing something with social determinants of health and the PERS Advantage program, but we'd be very happy to work with you to help help provide pricing for your program and your needs. See another question. What conditions do you cover under Medicaid plans? I think I'm not sure if Heather, do you want to talk about maybe some of what we do for Medicaid programs, some of the PERS Medicaid programs we have?
Sure. So it depends on what state you're located in. However, Medicaid is covered either directly through Medicaid or through Med Waiver in most states. There are a few that are still not covering it. And then if there is a managed Medicaid plan, they may be covering PERS as well. So it's not necessarily a condition, but it does fall under certain program criteria. So if you'd like to contact me separately, we can discuss it further, how it might be available in your area. And my contact information, it will be available after the webinar. Excellent.
I'll take one more question, and then I think we have to wrap up. Can you explain a little more about how member surveys are set up? I can take that question. I'm happy to. So the member health surveys are what I described on the tablet, where we can ask questions designed to identify barriers of care. And those are set up on our software platform, and we can set up branching logic rules. So for example, if you've asked, if they've had trouble filling a prescription, the answer is yes. The next question in series could be designed to appear, have you ordered, can you afford your prescription? That could be a second question. And so we can nest those questions. Each question is subject to we can apply logic to determine which questions are next. And then the protocols for each response can be set up individually, whether it's triaged by us or escalated to a case manager or reported on a weekly or monthly basis. All those can be set up. That's usually set up just in the process of our program planning. So after we, once contracting is complete, we'll typically set up a program planning meeting where we'll lay all that out. And if we need to, we can do it in 2 meetings if we can't accomplish everything in 1 meeting. So hopefully that answers the question. There's still a few other questions that we could not answer, so we will respond to those and they'll be available after the webinar. Brenda, would you like to say any closing remarks?
Yeah, sure. Thank you, Chris and Heather, and thank you everyone for joining us and for your questions. And as Chris said, if we weren't able to get to your question today, I know we went over time a little bit, we will certainly be reaching out to each of you individually and making sure that we get all those questions answered. And also, there will be an email to go out to each of you with a link to the recording for the webinar, so you can watch it again or share it with someone. And so be on the lookout for that one. So that concludes our webinar today. I want to thank you again for attending and have a great rest of your day. And we wish you good health.